Hello, ladies and gentlemen. Welcome to Cardiology lecture series. I am Dr. NIK NIKAM, and today we are going to talk about cyanosis. What is the definition of cyanosis? What are the conditions that cause cyanosis? What are the differential diagnoses, and how do we manage patients with cyanosis? Cyanosis is an important clinical finding at bedside. It is a very dramatic indication of what is the underlying pathophysiology, so it is extremely important to find out what is causing cyanosis. First of all, cyanosis is basically bluish discoloration of the tissues under the skin, which are supplied by an excess of deoxygenated hemoglobin. If the deoxygenated hemoglobin is less than 5 grams per deciliter of blood, we will see cyanosis. Cyanosis can indicate a number of conditions, starting with the heart, circulation, and various other factors that can cause cyanosis. So it is very important to get to the actual etiology of what is causing the cyanosis in a given particular patient, so that we can appropriately address our management of the patient as a whole. There are three major types of cyanosis, namely central cyanosis, peripheral cyanosis, and differential cyanosis. We are mainly concerned about peripheral cyanosis in the adult population. The central cyanosis is something we see most commonly in patients with congenital heart diseases. Congenital heart diseases, we see central cyanosis, where there is generalized bluish discoloration of not only the fingers but of the face and extremities all put together. We see this most commonly in patients with significant right to left shunt. That means those patients who have pulmonary hypertension, where the pulmonary arterial pressure exceeds that of the aorta. As a result, the blood is pumped from the right side of the heart to the left side, and this deoxygenated blood is circulated to the rest of the body, which causes central cyanosis. We see this in patients with severe ventricular septal defect with pulmonary hypertension, atrioseptal defect, or patients with tetralogy. These are most common conditions where we see central cyanosis, and especially we see them in the young children. In the adult population, the causes of central cyanosis are severe congestive heart failure. It can be related to high altitudes, where there is an increased amount of deoxygenated blood due to reduced partial pressure of the air in the atmosphere. We can also see this in patients with severe anemia, but it's not common to see cyanosis in anemia because there's an overall reduction in the hemoglobin content of the blood itself. When we see central cyanosis, we should always think about generalized conditions such as congestive heart failure, or deoxygenated blood from high altitude, or chronic obstructive pulmonary disease, where there is reduced amount of oxygenation to the blood. When we see localized cyanosis, that creates more problem because we really have to pinpoint as to what is causing localized cyanosis. We can see localized cyanosis in all the fingertips like we see here, which may be related to a very common condition known as Raynaud's phenomenon, which is a vasospastic condition, where there is severe spasm of the small arteries in the fingertips, which causes not only cyanosis, as we see here in the hands, but it can also cause severe blanching because there is absolutely very reduced circulation underneath the skin, which causes blanching. These patients need to be very carefully protected, otherwise they can develop gangrene of their fingertips. So they have to wear warm gloves, and sometimes they may respond to vasodilators such as procardia. When you see like localized cyanosis, as we see here, when one fingertip is all right, the other tips are showing varying degrees of discoloration, you worry about localized reduced circulation, which can be due to emboli, septic emboli, or clots coming from the left side of the heart. So those are the conditions which should really raise a red flag to look for more evidence systemically and see what is going on. We can also see this in patients with disseminated intravascular coagulation, or DIC. More commonly, we see this in septic shock, and then we need to focus on what needs to be done for the underlying condition, which is the septic shock. If we see a very localized discoloration of a fingertip, then we are talking about not only reduced circulation or poor circulation, there may be absent circulation. And this we see most commonly in lower extremities, like here, when there is reduced circulation due to a blood clot, the whole foot may turn blue, cold, and clammy. If that condition is not treated appropriately, if it's a chronic condition, it can lead to ulcer formation. So gangrene is a serious problem which we need to take into consideration, that is related to peripheral arterial disease, or PAD as it is commonly known. When we see localized blockage like this, it is related to arterial occlusion, and the treatment for that is improving the circulation through either bypass surgery or placing stents. But if it happens acutely, like in this situation, if there's a sudden blockage of an artery, then we are talking about an embolic episode, in which case we may have to put a catheter and remove this by embolectomy and thus restore the circulation. We see this most commonly in the major arteries such as the femoral artery or the popliteal artery, and they can be easily treated in the endovascular suites, Fogarty catheter, and pulling the clot out and re-establishing the circulation. So these are some of the different conditions that can help us to identify what is cyanosis, what are the differential diagnoses, so it will help us to focus our attention on the underlying causes. Cyanosis is a very important clinical finding, especially if it is localized like this. That should quickly raise a red flag, and conditions like these could be an emergency. If it's an arterial occlusion, we need to move quickly and fix those things. A rare condition which I would like to discuss that can cause what is the third form of cyanosis, namely differential cyanosis, is due to pulmonary hypertension happening from the right side of the heart that causes the blood to not only go into the pulmonary artery, and because of high pressure in the pulmonary arteries compared to the aorta, the deoxygenated blood goes through the patent ductus arteriosus, PDA, and that causes cyanosis in the lower half of the body, whereas the upper part of the body maintains pink color due to oxygenated blood going to the upper part of the body. That is an extremely rare condition. I have not seen one myself, so you see them more commonly in pediatric population. That is the differential cyanosis. Going back to the previous slide here, the most common causes are the central cyanosis related to severe congestive heart failure, severe chronic lung disease, and those things need priority in terms of treatment. If you see localized cyanosis, it's a sign of embolic phenomenon, and we need to look for any evidence of emboli, and they need to be treated appropriately. If you see conditions such as this, which may be related to vasospastic conditions, then we need to treat them appropriately by using vasodilators, keeping their hands and fingers warm, and prevent them from going into gangrene. And when we see reduced circulation in lower extremities, we are talking about peripheral arterial disease that needs diligent workup, including the duplex scan, arteriograms, MRAs or CAT scans, followed by vascular intervention if it is needed. So that is a brief overview of cyanosis in general and how we approach as to what needs to be done to differentiate the various causes and what are the treatment options available based on the underlying causes. Thank you so much, ladies and gentlemen.